Hey guys, it's Rita. So I just really quickly wanted to do a video on some postpartum mommy must-haves, or aka hospital discharge must-haves, that I have been using since I've been discharged. I'm now on day 6 postpartum, which would actually be day 4 home from the hospital. So basically, I know this video is kind of more for like the first time moms, because a lot of us who have had babies before know about the goodies that they send you home with, but a lot of the first time moms might hear us talking about it and may not be able to put a visual to it. So I'm going to go ahead and start talking about the things that I was sent home with that I've been using basically every day that really helped me out and that I think that every mom should have. So definitely speak up at your hospitals, make sure that they have goodies to send you home with, and don't be afraid to ask. So basically the first thing that I don't have a visual of that I think is very important that you ask for is medication. If you're in any kind of pain, discomfort, make sure that you speak up while you're in the hospital. They're not going to send you home with any kind of prescription. If you weren't speaking up in the hospital and saying you were in pain, they're not going to think you need medicine going home. So definitely speak up. While I was in the hospital, I was taking a Percocet and ibuprofen for my pain, which I'll explain in my labor and delivery video what type of pain I had. Pain can be, anything from just vaginally delivering the baby, or pain could be something from maybe episiotomy, stitches, hemorrhoids, anything like that that comes from having a baby. So definitely speak up. So the prescriptions that I was sent home with were ibuprofen that I could take every 6 to 8 hours, not the Percocet. I did not get a prescription for that. Percocet's a little bit stronger. It affects your body a different way. And if you really do not need Percocet, I would, don't get a prescription and take it home. It's just, I don't know. That's just my thoughts on that. So I got ibuprofen instead. And then I also went home with a prenatal vitamin. So definitely, you might already have some at home, but ask for a prescription if you don't, because it's very important to continue taking your prenatal vitamins at least 6 weeks postpartum, and then if you're breastfeeding and things like that, definitely even longer than that. The other thing that I went home with is a stool softener. So if you already have children, you've been postpartum before, then you definitely know what I'm talking about. I don't even need to explain. But for the first time moms out there, sometimes it can be a little nerve-wracking to have a bowel movement after having a baby for many different reasons. And some of those reasons might include that you got stitches, that you tore, just the pressure of your rectum filling up might hurt. You might just be constipated, period. So a stool softener definitely helps speed that process up. Some hospitals require that you have a bowel movement before you're discharged, and others will just send you home with a stool softener and call it a day. Okay? And the last thing that I went home with was a iron supplement, an iron pill. My iron is low. That's something that I already was aware of. But definitely all the pricking and blood drawings that they do on you when you're in the hospital, they're going to let you know if, you need a supplement for something. And mine happens to be iron. So I'll be taking 2 pills a day to try to get my iron up. Okay? So medication, definitely speak up. One of the other things that they send you home with that you actually use while you're in the hospital most of the time are these nice pads. These are just pads that go on the bed. This one is like a reusable fabric-y kind, but they also have like the plasticky blue or pink pads that go on the bed that you can throw away. So definitely get those because they protect your sheets and stuff like that. You're going to be bleeding. It's normal, but you definitely want to protect your linens and things like that. So make sure that you get some of those to bring home. Okay? So now I'm going to start showing you the little goodies that they give you. Speaking of bleeding, hello, pads. So my hospital gives you 2-pack of 12 just OB Maxi sanitation pads. Now they give you more to use while you're in the hospital, but then in the mommy take home bag they give you a total of 24. Now these worked fine for me, but what I did do was for nighttime sleeping I needed something with a little bit more coverage because I am breastfeeding in the middle of the night, and if you know anything about breastfeeding postpartum, it does cause you to bleed a little bit more as the baby's sucking, and yeah, use your imagination. So what I did was I went out and bought something similar to Depends, but not Depends, but they're like disposable female underwear that I could wear at nighttime. But yes, pads, they're great. Okay, the next thing, remember those great old mesh underwear that everybody talks about? Well, these are them. So these don't look like underwear, but trust me, they are. They're just very thin and very stretchy. As you can see, they look like that. Nothing special at all, but they get the job done. They are very thin, very airy, very light. See, they're mesh. Some people don't like these, some people do. I think they're great because I would rather get these nice and yucky and throw them away rather than get my own stuff nice and yucky and have to try to wash it or throw it away and have to buy new stuff. So, hello, mesh underwear. The next thing are these blue things, and I call these ginormous panty liners because, well, they look like ginormous panty liners. And actually, what these do is, these pads are short, and that's why some women will go out and buy longs for themselves. But what you can do is you can put this big thing in your underwear and then put your pad on top. And what it actually does is if there's any leakage or any additional spillage, this covers all the way up your front, and then this goes in your underwear all the way up your backside, even onto some part of your back. So it'll catch any little drippage or spillage that you might have extra. Sorry if this is TMI, but hey, read the title. This is a mommy postpartum delivery must-have video. So you're going to see some things, or like some language that's like, ew. So the next thing that I want to talk about is these things are called Tux pads. So this is the first time that I've ever used these, but basically they're like little cooling pads, kind of like antiseptic wipes, like so. You see how many I've used? And basically you can wipe yourself with these after you urinate, after you have a bowel movement. You can just wipe with these along with toilet paper, but these clean and kind of sterilize. That way you're lowering your risk for any types of infection. So along with those, you'll also get tons of the little alcohol antiseptic wipes. And you might think alcohol, ouch, but trust me, when you have cuts and stuff down there, tears, anything like that, abrasions, it actually feels good to clean with these. It might sting just a little bit, but at least you know that you're not going to have an infection or anything like that from leaving any yucky stuff down there that needed to be washed or wiped away. Alright? So the next thing is this cream. I'd never used this before either, and it's basically gone. And this actually was basically almost gone before I even left the hospital. It's actually called Novocaine Ointment UPS 1%, tropical antiseptic use, temporary relief of pain, itching associated with hemorrhoids, cuts, scratches, and burns and stings. So this is more like for stitches or for hemorrhoids or anything like that. Tears, cuts, abrasions down there, all that good stuff. The way that my nurse used it was she would take one of the pads that I had and she would just squirt this down the middle, basically so that it would get right down my middle and cover anything that was going on down there, which I'll talk about in my labor and delivery video. Okay, so ointment. Alright, so the next thing that you can use, and you can actually get this at any convenience store, I'm pretty sure, but it's called Dermoplast. And basically what it is it's just a quick relief spray. Let's see, what are the uses? For temporary relief of pain and itching associated with insect bites, burns, scrapes, skin irritation. Basically, it's like a cooling agent. You spray it on and like the area that was hurting, it just feels cool. It feels like you froze it temporarily. This is extremely temporary relief, but when you're in pain down there, anything helps. So after you use the bathroom, you could just spray this, or if your cut or stitch or anything is bothering you, you can just go and spray this really quick. The pain relief might only last for a few minutes, but I like this stuff. It goes quick because the pain relief is so temporary. The next thing that I have, these next two things are my favorite, and I don't know what I would do without them if I did not have them. But basically what they are, this is a ice pack pad. It is a ginormous pad. It's nice and long. And if you can hear, there's like these little ice cubey things in there. I have no idea how this works, but they are the best. It's called a perineal cold pack. See? And I actually want to try to find out, it says Medline on here, or like where you could order these from for yourself, because they give you enough to go home with, but I wish they gave you more. It's just awesome. Oh my gosh, especially when you just have a baby. You're swollen down there, you're sore. If you have to get stitches or anything else like that, oh, it feels horrible. You take one of these bad boys, you open it up, you crack it down the middle and then shake, and it turns into an instant ice pack. And you just put it down there. The way that we used it was you take this and then you put this in there, and then you just put it in your underwear, your mesh underwear or your regular underwear, and oh, it is relief for hours. It feels so great. All right, that's enough about that. And then my next favorite thing is the perineal spray bottle. Now this, it's a simple plastic bottle with a spray. You can get this at any store, I'm sure. It probably costs like 25 cents to buy one of these somewhere at 50 cents. But it's amazing. It's my best friend. It's my best friend, especially if you have to get stitches, if you have abrasions, anything. You fill it up with warm water, and while you're taking a tinkle on the toilet, you're spraying as well. And it just relieves any pain or burning feeling that you might have, any soreness, irritation. Sometimes the simple things in life are the best things in life, and this is one of them. So even if your hospital doesn't send you home with this, you could just get any kind of spray bottle and relieve yourself by, you know, drizzling warm water while you're using the bathroom. It's awesome. So that is actually the last thing that I had on the list that I've been using. But when it comes to other things, let me see. I'm trying to think of what else I used. Oh, if you're breastfeeding, definitely another mommy postpartum must-have would be some sort of breast pump, whether it just be a hand pump until you can maybe possibly get an electric pump, some sort of breast pump. Because if you're like me and you have these jugs, when your milk comes in, and you're going to need some relief. Now me, currently right now, I just have a hand pump, but my doctor did write me a prescription for an electronic hospital grade pump, and I just called today and it was approved, so it should be here tomorrow or Wednesday, and I will definitely do an unboxing. My insurance completely paid for this breast pump, so I'm very, very excited to see which one I get. Is it a Medela? What is it going to be? Because it's mine to keep, and I'm just excited. I didn't have to pay for it. Yes. Breast pads. Once again, because you're going to be leaking like crazy, and so just having breast pads is an awesome idea, okay? I'm trying to make this video quick. The only other thing that I can think of is a lot of hospitals give away like little book bags like this, little mommy take-home goodies from like Gerber and stuff like that. This one comes with a can of formula, and then it comes with like some mommy guides that teach you about breastfeeding. They also teach you about how to make bottles if you're bottle feeding, teach you like how long you can leave formula out for and stuff like that. And then diapers and wipes. You get to take home like all of the extras from the hospital, at least my hospital lets you. But I just think that these goodies are great because you never know when you're going to need it. I'm breastfeeding. This has formula in it. I did have to use the formula the first day home, which you'll find out why in my labor and delivery video. But yeah, for emergencies, you never know when you're going to need these hospital take-home goodies. So between all of that great stuff and this stuff, those are my mommy postpartum must-haves, and I just thought that I'd share with you guys. So comment, subscribe, let me know if you have any questions, and look out for all the other videos. Bye.